Alright, so recently I've been watching a lot of tennis on the television and on Netflix as well. The French Open started 2 weeks ago, and I've been watching every match I can, and there's about 30 a day. So in my head, I'm an exercise science major at my school, so I begin to think, what type of injuries do these players kind of incur, because it is such a high demand of matches per day, and these players are playing, up to 4 hours a day. Their matches can take 4 hours a day, and they're playing every 2 or 3 days. So, my mind automatically goes to, what injuries are these people, having to go through daily, or are there any major injuries that these players, just pick up from playing these high intensity matches? And, tennis is a type of sport that requires a lot of just torsion, twisting, repetitive movements, and just a lot of explosiveness in every movement you do, and it happens in every single point of every match. So of course my head goes to the internet, and I go search up what are some injuries that tennis players occur and what are like major ones. And so today I'm going to talk about the hip labrum and how that injury, it's the hip labrum is underappreciated until you realize there's an injury to it, and it becomes a big problem, especially in high-level athletes such as tennis players that require those quick explosive movements and rotational power behind their swings. So that's what I'll be talking about today. It's just kind of how important the hip labrum is and what type of role it plays in the movements of tennis players and just in your body in general. So again, we'll start with the importance of the hip labrum. It's a piece of cartilage near the head of your femur, so that little ball in your femur that connects up to your hip. It kind of holds it's called an acetabulum in your hip. It holds that and the ball of your femur together. So it helps stabilize those two things together. It kind of helps with the fluid balance in the joint, and it acts as kind of a cushion for impact. So those high impacts where they're having to lunge and jolt fast, it acts as that cushion, and it helps reduce the impact. So without that hip labrum, you can incur more injuries if that hip labrum is torn. So let's talk about kind of the demands that tennis plays on the body and on that hip labrum. So again, kind of as I mentioned, there's a lot of torsion, so turning, twisting. There's a lot of rotational power that you have in your shoulder and in your hips. So, if that labrum's torn, it can't help reduce that impact and, kind of balance that out throughout the hip rather than in one spot. So this is an injury I've had as well. So these symptoms that I'm listing are kind of things I experienced firsthand, but also things that I have read that also are symptoms. So symptoms, we'll start with those. Deep groin pain, so it's more feels like within your body, deep in there, you can feel a pain, and it's kind of agging, it doesn't go away. And, it's always there, but then, when you're doing these movements, it of course intensifies. Then you have stiffness in your hip. So this is something I experienced when I go to open my hip up. It catches, and it has this catching sensation, and it's like you can't open your hip up all the way to do the whole movement. So it limits your range of motion in your movements, so you can't do them as well and can't get as much power. Sprinting, you have to sprint from side to side, forward, backward, and again, if this labrum is torn and it causes pain in your hip because it doesn't have that cushion or that stabilization, it's going to hurt you to sprint, and you're not going to want to push off as hard. You're not going to want to change directions as hard or lunge. So again, that's kind of the demands of tennis, and then the symptoms there. And then, like I said, you're not going to want to sprint as hard if you're going to be in more pain if you push off harder. So I call them compensatory movements. So you compensate, and you figure out different movements that you can do other than your original movements or your movements that are natural to you. You kind of compensate and do movements that you wouldn't normally do because that, it's going to hurt if I lunge this far, so I'm going to take an extra step, or things of that nature. which can also lead to other injuries besides a hip labrum tear. So let's talk about how can I prevent a hip labrum tear. You can do deep stretching every night, strength and conditioning focused on your hips and your core, so that it's not, you have those muscles around your hip labrum and your hip and your core that can help reduce the impact you put on the hip labrum, because those muscles are strong enough to hold. You can have a proper warm up, so you don't just go out there and lunge, don't just go out there and sprint right off the bat. Get a proper 10 to 15 minute warm up, and that's including just short little lunges, warm up lunges, out to the side, butt kicks, high knees, anything. And then you want to work on kind of your technique refinement is what it was said. Like, the best way to move your body so that you don't place these stresses on your hip labrum. So that's either you could get a coach for that, like a physiological, like biomechanics coach for that. So biomechanics is basically just the best way to move and in the least amount of effort. So tennis players do get biomechanics coaches to teach them, this is the best way to serve, this is the best way to hit a backhand, forehand, things of that nature. And you can get one to kind of just help talk about how do I reduce the impact that I put on my body, but still allow myself to have the best outcome. So those are the prevention techniques. And then of course recovery, you can ice it, you can put compression sleeves on it, you can wrap it, there's not much you can do once it's torn other than try physical therapy and then most likely surgery. So again, the recovery from surgery is 3 to 5 months with PT 3 days a week, and the recovery process is obviously not as long as an ACL, which would be like 9 months, but it is a prolonged recovery, which takes a toll on your mental health as well. But again, the hip labrum is so important in this sport, and it's underappreciated because it allows you to do these explosive movements and these quick, agile sprints and things of that nature. But then once you realize this hurts in my hip, and you realize, my labrum's torn, you begin to really appreciate what that thing does for you and your body. And so that is kind of my second informative speech for the day.